One of the questions is, I think in Europe, for example, they've done much better at standardizing MRD testing, and we've done very poorly in the United States. There's no question, there's just been a very nice meta-analysis published of all studies in ALL looking at the impact of MRD. And there's no question that it is probably the most important prognostic factor. But how one can do that and make it reliable remains to be tested. And it's not going to be tested in the United States because everybody does their own thing. And so I think as the labs are getting better at doing MRD by flow, that will be perhaps a bit more standardized. The PCR techniques are much more standardized but much less used in the United States, also more sensitive. And that's what we're doing as part of our trial. Now, the next step, I think, in the US anyway, will be these Nextgen MRD methodologies. They're expensive at the moment. They require quite a lot of material in order to do the analysis for the minimal residual disease state. So it worries me a little bit about the samples that they're getting to analyze. I'm not sure they're the exact right samples. They might just be blood samples that they're analyzing, not really good marrow samples. But I think they are totally standardizable and potentially have the ability to more uniformly and more precisely identify minimal residual disease, but we don't know that yet. And the costs are quite high at the moment for doing that kind of testing. But I think that is the next area of MRD testing, both for AML and for ALL, are these next-gen sequencing MRD approaches. And in ALL, it's at the moment a bit easier to do because we look at the clone-specific immunoglobulin and TCR rearrangements.